Hello everyone, happy Monday. Welcome to Within the Frame, where we delve deeper into the top stories not only in South Korea but across the globe. I'm Kim Bo-kyung. Starting Monday, South Korea lifted mandatory indoor mask wearing rules after more than 2 years of the rule being in place. Though some venues, hospitals, pharmacies, and on public transportation still require them, it still comes as a big change for people. Now, South Korean authorities are looking at the 7-day self-isolation period to see when it would be right time to reduce it. But is it okay to let our guard down? What is going to happen with the 7-day isolation? And could we say that the world is slowly moving into an endemic phase? For an in-depth analysis, we invited Sohn Ho-joon, Associate Professor of Preventive Medicine at Seoul National University, to the show. Professor Sohn, welcome.
It's good to be back.
And we also have Sanjaya, Professor of Infectious Diseases at Australia National University Medical School. Professor Senanayake, welcome and thank you so much for your time.
Thank you.
All right, let's first touch on the background on how South Korea decided to lift the indoor mask mandate. Now, Professor Sohn, the government said that 3 out of 4 criteria for scrapping the mandate have been met. But why these 4 criteria and how are they significant?
Yeah, so these are important measures which we can monitor disease severity, transmissibility, and the health system's responsiveness and capacity to control the disease. So these criteria that so far met or sort of on the borderline look at the, first of all, stabilized level of transmission, which is determined by stable levels or declining levels of new cases that are being reported. Disease severity is being measured based on case fatality rate. We want this to decline or remain consistent or stable at around 0.1% per 100,000. Now, this particular measure is so far on the borderline. The most recent report says that that came out is around 0.8 per 100,000. Which is declined to about 0.5. So it's sort of meeting that criteria. And then the other measures are, health systems capacity, especially for being able to take care of those people who are severely ill and need to be admitted to ICUs. This needs to have the capacity available at least 50%. So far, Korea has been operating around 25% of the capacity, so it's more than enough. And we want, and lastly, importantly, we want those people who are at highest risk. These are people who are in the older, above 65, to have been vaccinated in full at 50% or more. The problem with this is that the basic vaccination for the first and second has been more than enough met at 90% or higher. But for new convalescent vaccines have not been vaccinated at this level. It's around 30%. So these needs to go up a little bit to be a little bit more comfortable with this decision. But so far, we have seen a decline in new cases, disease severity go down and remain stable, and have a good responsive health system that has the capacity has been under relatively utilized at low level. So we're looking good so far.
Right. That was explanation for the 4 criteria. And Professor Senanayake, South Korea became almost the last country to lift the indoor mask mandate, but eventually did so based on the criteria that we talked about previously. But do you believe the timing was proper?
Yes, I think it is reasonable. It's one must remember that with masks, it is just one of those many interventions we use as a bundle to try and control COVID. And I think many people would probably agree that the most important interventions are a combination of vaccination, which is deliberate, and getting COVID, and getting immunity from getting COVID, so an accidental infection with COVID. That hybrid immunity is the key to us moving on with COVID. But all these other things, social distancing, masking, it does make a difference. But because most countries around the world, including Australia, where I am, and South Korea, have got a lot of hybrid immunity from a combination of vaccination and natural immunity from natural infection, particularly in older people who are most vulnerable to hospitalization, it is reasonable to pull back at this stage on mandatory mask mandates. Even in Australia, it is not mandatory except in certain areas. But even though it's not mandatory, people can still choose to wear a mask, particularly if they're high risk, particularly if there's a surge in cases, particularly if it's a crowded area where they can't socially distance.
Right, so it was a reasonable decision given that we have a high degree of immunity right now in South Korea. But Professor Sohn, actually, there are some venues still where masks or coverings are still required, such as hospitals and public transportations. It could be confusing for some people right now, but how should we understand the standard for some places that require wearing masks and those that do not?
Yeah, so in general, and this is a rule that I usually apply to myself, is that the simplest criteria for determining whether one should mask up or not should be based on the level of congregation. So the basic idea is that the more people congregate, the greater the risk for potential transmission because you don't know who's actually being infected. Second important criteria is the composition of people at the congregated setting who may be at risk of developing severe disease or people with infected cases, infected COVID, are visiting more frequently. And these are, a good example is a hospital, right? It's a place where sicker people congregate and visit and to be treated for COVID and other illnesses. And these people also may be at higher risk of developing more severe disease after contracting COVID-19. So when visiting these types of locations, we should be mindful of others and as ourselves for protecting from being infected. So definitely we should mask up in these type of settings. Of course, one way to really adhere to this is that we don't know when we are actually going to visit these types of places, and these are very dynamic locations, that we should always carry a spare mask or two in our bags so that we can adapt to these type of situations.
Right, so as long as we are at crowded places, we need to have our mask on. But Professor Senanayake, I believe what people wonder the most right now is whether it is really safe medically to say not to wear any mask indoors. I know that you have said that it was a reasonable decision for South Korea to make the decision right now, but what if another surge of COVID-19 comes in the future?
Right, and in Dr. Son's answer, he used the important word, you have to adapt. And that's the thing with COVID. So we can't have fixed rules about COVID. We have to be willing to adapt. So if we have another surge in COVID, there's a new sub-variant that appears that causes more cases, then yes, of course, we should mask. And as I said, just because it's not mandatory to wear a mask, it's not mandatory to not wear one either. So again, it's your own comfort level. If you feel more comfortable wearing a mask, if you're at higher risk because of health problems, if you're in congregating in large groups of people, as Dr. Sohn said, there's no reason why you can't wear a mask. And even in Australia, where wearing masks for respiratory illnesses prior to COVID was a very unusual thing. It's now part of our culture. In many parts of Asia, such as Korea, no one will look at you strangely if you wear a mask again. So it doesn't mean don't wear a mask, but the fact that we can say this means that we're heading in the right direction with regard to the pandemic.
Right. Now, another issue that has been hotly debated is actually 7-day mandatory quarantine for those who test positive for COVID-19. I mean, South Korea has been imposing the toughest level of quarantine measures. But why for 7 days, Professor Sohn? And if there should be any change made for these quarantine measures, how long do you believe would be proper?
Yeah, so typically when we determine period of isolation or quarantine is based on the measures of duration of infectiousness, right? So people can transmit the disease. And for COVID-19, and for most of the infectious disease, these occur when patients become symptomatic. The challenge for COVID-19 in determining this duration initially and why it was so long is because we know that patients without significant symptoms or no symptoms can actively transmit the disease. Of course, the other side of this determining quarantining, or whether or not we keep the quarantining rule, the mandation of the quarantining, is the practicality of the actual quarantining in preventing transmission. Of course, quarantine, when adhered in full and monitored and managed, is very effective in transmitting prevention of the transmission. But at this time, in many countries, including our country, testing is voluntary, reporting is voluntary. Therefore, quarantining, mandatory quarantining, is not as effective as what it used to be. So in the U.S., for example, have long recommended isolation durations, which are based on symptom levels. So for people with less significant symptoms, they are recommended, right, to remain isolated for at least 5 days. For those with more severe illnesses, are recommended to extend that quarantining or isolation to 10 days. If you are severely immunocompromised, this can be longer. But again, all of these, the countries have been, other than Korea, have been going under recommendation rather than mandation of the quarantining. So this should and will likely move to more of a recommendation level, as with what we're doing with masking.
Right. Now, Professor Senanayake, KDCA said it will discuss the issue of loosening 7-day quarantine measures after the World Health Organization declares the end to the COVID public health emergency of international concern. But I wonder, what is PHEIC and what are specific parameters of a PHEIC?
So the PHEIC, Public Health Emergency of International Concern, is based around the international health regulations, I think from 2005, which are international health laws that member states of the UN follow. And if there are concerns about a new illness, a IHR emergency committee will be formed, which usually involves experts from various countries, typically also the state or states in which the new disease has occurred. And they all report up to the Director General of the World Health Organization. And for it to be a public health emergency of international concern, it has to be an extraordinary event deemed to be a public health risk to other states with the possibility of crossing international borders. So it's a fairly broad definition. I think we could all agree that COVID meets that, and that will allow the Director General to issue recommendations, and that'll filter down to various governments. It might allow more funding for this particular public health emergency of international concern to occur. But whatever edicts are announced by this committee, every 3 months they have to reevaluate it, because of course pandemics change. They might be worse, they might be better, and therefore you would change your recommendations at 3 months. So since being declared a public health emergency of international concern in 2020, COVID is still that, because we're getting it under control, but we haven't quite got there yet.
Right. The WHO's emergency committee decided just right now to maintain that PHEIC level. But what do you believe were the reasons for such decision by the committee?
Look, I think it's a reasonable thing to do. We are, as a global community, getting on top of COVID, but we are still not there yet. So even though we are lifting mask mandates and physical distancing, doesn't necessarily mean that the COVID emergency is over. And it's quite reasonable for the World Health Organization to announce that we need to continue to be cautious. And I'll take you back to September, when the Director General of the World Health Organization said, we are nearing the end of the pandemic, but we're not quite there yet. It's like being at the end of a marathon, but instead of slowing down, you should run as fast as you can. So we mustn't lose momentum. And in fact, they brought out 6 policy briefs that countries should have in place before COVID becomes endemic. So they revolve around things like making antivirals, testing part of your regular infrastructure, making sure that vaccine disinformation and COVID disinformation is addressed. So a whole, and that testing continues and that surveillance is very efficient. So all these things have to be in place. And of course, we still don't want to see 20 or 30 people in Korea or 50 or 60 people in Australia dying of COVID every day just yet. That still, in my view, means that it is a public health emergency of international concern, although we are heading in the right direction.
Right, it's really easier for us to understand, compare as we make the comparison to marathon, because we really need to run until we meet the end of the line. Now, Professor Sohn, if one day WHO does declare end to PHEIC, South Korea said it would discuss downgrading the infectious disease level of COVID-19 in its four-tier system from level 2 to level 4. Now, how is the tier divided in South Korea, and what are the criteria for that?
Yeah, so communicable diseases governed by the National Infectious Disease Control and Prevention Act are managed in, as you say, four-tier systems. These tiers are primarily defined based on disease severity, transmissibility. And this determines how we identify patients and manage these patients and notify them, and as well as monitoring of the disease itself. So tier 1 disease are those at the highest level with transmissibility and severity, which can also cause outbreaks. And patients with diseases require quarantining and monitoring in a negative air pressure units. And a good example of this is Ebola virus. Tier 2, which COVID-19 belongs to currently, and tuberculosis, are those diseases with concerns of high transmission and require quarantine, but not necessarily in a negative air pressure unit. Quarantining up to this level is an important control measure. Diseases in other tiers, 3 and 4, some include malaria and influenza, particularly do not require quarantining and surveillance based on periodic sampling of the population. As you say, there is an ongoing debate whether or not COVID-19 should be moved to these low tiers. But moving to these low tiers essentially would mean that COVID-19 will be managed and surveilled based similar to the level of influenza. So, and it eases how we are monitoring the system, and then it's also a declaration of the disease becoming an endemic. So we'll see how this moves, but this is likely going to move to that level in the near future as soon as the WHO declares.
Right. Now, Professor Senanayake, we have scrapped indoor mask mandates, and we don't know for sure, but one day we're going to classify COVID-19 as the same level as flu. Though the proper timing might vary, could we say that COVID-19 has really in the process of becoming endemic?
It's definitely in the process of becoming endemic, but it's still not there yet. Now, when we talk about something being endemic, like influenza, for instance, in Australia, it means that we accept a certain level of influenza over a period of time. So, for example, during the summer, spring, and autumn months, we would accept very small numbers of cases of influenza, but in winter we expect a lot more, but only to a certain level. And if we find we're getting more than usual, we call it epidemic. We may see more hospitalization. I put it to you that right now, what we're seeing in Korea, in Australia, in many parts of the world with COVID is not acceptable. We don't want to see 20 or 50 people a day in our countries dying every day from COVID. And we don't want to necessarily see 1,000 or 2,000 new diagnoses every day. So it would not be endemic in my book. Now, is there a specific number that makes something endemic or a specific rate with COVID? Not necessarily, but I would imagine that something more seasonal, where we see small numbers of cases through certain months, maybe more in winter, and certainly far less deaths and hospitalizations, then COVID will be endemic. But as the World Health Organization has said, as we've touched on in this discussion, we have to move to that slowly. It's not a sudden transition. It's a gradual transition. that we're going through. And as I said, we're heading in the right direction.
Right, it's really good to hear that we are heading to the right direction. Professor Sohn, though most of the social distancing rules are in phase of being scrapped, people might still worry about it. What is the best way to protect ourselves?
Right. Professor Senanayake already mentioned, and I've also mentioned it briefly, masking mandate is maybe gone, but it's at a recommended level. Quarantining will likely become recommended level. We should follow those recommendations when possible at personal discretionary measure. Carry mask when you're visiting highly constrained and restricted areas in a space, congregated settings. Wear your mask. Avoid those situations when possible, especially when you're sick and you seem to have respiratory illnesses. And really be mindful of others when you're interacting in situations in a very congregated settings and visiting locations where people who may be highly immunocompromised or at high risk of the experiencing severe COVID-19.
All right. That is all the time we have for today's edition, unfortunately, but thank you, Professor Sohn and Professor Senanayake, for your insights. We really appreciate them.
Thanks.
Thank you.
That's all for Within the Frame tonight. Have a great rest of the evening, and I do hope everyone enjoys the fresh start of the week safely. We will be back tomorrow with more in-depth stories on the issues happening in South Korea and, of course, around the globe. Thank you for watching, and goodbye.